My name is Michael Balch. I've been at Stanford for just almost 2 years, but I've got 22 years in the air medical industry as a flight nurse and as a director. Stanford Life Flight is an air medical transport program that will transport patients from accident scenes to trauma centers or from outlying hospitals back to Stanford or other hospitals for specialty care services. I have a great staff here of 13 flight nurses, 4 pilots, and 2 mechanics. In addition to those people, we've got a communications center made up of communication specialists. So there are about 20 some odd communication specialists who also work with the Life Flight team, and they are a really essential and important cog in not only carrying out safe flight operations, but getting the patients to where they need to be. Our staff of 4 pilots are military veterans. That's not a necessity, but it's just the pool that we have. Before they're hired here, they're required to have a minimum of 3,000 hours as pilot in command. Our pilots are very experienced. Most of them have an excess of 7,000 hours. In other words, we fly in some bad weather, and they fly on night vision goggles. So they have to be trained to use the night vision goggles, and they have to be expert in navigating and landing on unprepared landing zones with the night vision goggles. Let's talk about the flight nurses. It's kind of popular to say that the flight nurses are type A personalities. They really are driven and compassionate about what they do. They are very good in the middle of chaos, but they never really show it. You know, you can check their heart rates, and in the middle of a lot of noise and confusion, their heart rates never really get up. And that's one of the things we count on, for them to bring their skill, their judgment, and really this sense of calm that tells everybody else there, including the patient, that it's going to be okay. As a hospital-based program, we have to work very closely with all the other critical care departments within the hospital. When we're not flying, the nurses are often in the ICU or the emergency departments helping out in those departments, particularly when they get a heavy patient load. They're used to taking care of very sick, very complex patients. Because they're advanced skill practitioners, they respond to code blues, they respond to stroke codes, they respond to any requests in the hospital, even to start IVs, which is a skill that they're particularly well trained and capable. "30 years of service for Stanford Life Flight is the most remarkable thing, is that 30 years has been accident-free. Safety is our priority. We train for that, we drill for that, and we talk about it in everything we do. One of the things that is most rewarding for me as a manager and a leader of this group is that I sleep really well at night, knowing that the people that we have here are on duty. It's working with an elite team and the sort of camaraderie that you get when you work with people who at times put themselves at risk. It really is the commitment to give patients the best care and to do it in the most safe way that allows me to know that they're going to leave and then they're going to come home every day."